I think what we need to do is keep our eye on the ball. Whatever the Senate does, whatever the House does, how does that impact what we have right now? And what the House did took away between 20 and 25 million people's health insurance. I think anything that the Senate does should increase people's coverage, not take it away.
There's a lot of talk about the amendment, the MacArthur Amendment, which added, allowed states, if they wanted to not cover pre-existing conditions. What would that mean?
Well, we'd go back to what we had before. And in North Carolina, there was a high-risk pool where people who couldn't get coverage were supposed to go. It would cost routinely thousands of dollars a month. It excluded pre-existing conditions that the very people who wanted to come and use the pool couldn't get coverage for those conditions for a year. And as a result, there were only a few thousand people who ever really signed up for it.
And President Trump promised during the campaign that was one thing he would do, was to cover pre-existing conditions.
He promised he would cover pre-existing conditions. He promised he wouldn't cut Medicaid, and he promised that again and again and again. And the American Health Care Act doesn't guarantee that pre-existing conditions are covered, and it cuts Medicaid to the tune of $800 billion.